My name is Ayo Ghazal, and I'm a third-year General Surgery resident.
Hey, I'm Katie Abrusha. I'm one of the first-year General Surgery residents.
So we are a smaller program. There's 20 of us. We're very busy. We have a ton of people that we care for. In the morning, you come in, you get your sign out from the night team, and then you're getting numbers for the day. You round to your patients, you staff with the attending, and then usually by about 8 o'clock, you're in the OR.
We have a really good relationship with our attendings. I think we have familiarity and comfort that I haven't seen in other places where I've been, either as a visiting student or a home student.
During the day, depending on what service you're on, you can get consults. You kind of have to manage, sneak it in and out between cases to see those patients. Sometimes putting fires out on the floor, but for the most part, it's pretty operative heavy.
I think our faculty do a really good job of checking in with us, and they're comfortable and capable of taking on extra responsibility if we need extra assistance, and also just providing reassurance to us when we are feeling stressed or spread thin.
It's really just typically you and the attending. So at other places that I've been to, it's you, two fellows, the attending's partner, you're really deep and you're not really getting your hands dirty and doing it. But here, especially as I've gotten further and further along, I see that it's just you and the attending.
I think that if you want a place that has high autonomy, we get into the OR very early, even as first years. I have over 300 cases logged at the end of this year, which is 3 or 4 times, if not higher than average for most other programs.
The best part of the program, shallowly, the food is free 24/7 all the time. Never have to pay for food.
I think the people are the best part, from our co-residents to our faculty to our administrators. That was the reason why I picked this place, is because I really had a good energy and sense of community when I was interviewing.
The residents and the attendings and the faculty are very close. They're kind of people that you can talk to if you're having a bad day personally or also professionally. If you had a tough patient, they're always available to be a support system to you.
So I think they do a really good job of supporting and nurturing our learning, and being good role models too, by seeing how they handle things, and then we can emulate that. So I think they do a really great job working with us and alongside us.
We pretty much get everything for the rest of the state that doesn't go to Chicago.
We see a lot of really interesting stuff, so really rare surgical complications, really rare presentations, as well as very run-of-the-mill things. So I think we get a really wide variety of things, from simple gallbladders to things that are very complicated.
We always joke we've taken out every gallbladder downstate, we've taken out every appendix downstate, and we don't know where they keep on coming from.
As far as it being a very large encashment area too, we have very high volume. And especially from a trauma standpoint too, we can get penetrating, non-penetrating trauma, and a really good variety of things. So I think that servicing such a large area is really good for our learning.
I think it's pretty sweet because you kind of see everything. You see the farmer from middle of nowhere that doesn't have any medical problems, who's never seen a doctor before, that's actually very sick. And then you get a lot of your bread and butter things, but there's such a wide variety of pathology. There's really everything that we get. The thing for me is that Peoria really has everything that you need. If you want to go to some nice restaurants, they have it there. They have a surprising variety of foods, which was a big thing for me.
I think we have everything that we need here, and then a little extra too. I live downtown and I love the downtown area.
For us, we're working a lot. I can't understate that. You're in the hospital so often. So for the time that you do have outside the hospital, everything that you need is here, and that's really important to me.
So I think it's refreshing, but it's also familiar. So it's kind of a blend of what I've been used to in a rural setting, kind of compared with some of that more metropolitan, and we have 2 targets. That's awesome.